Aside having numbers of publications to his credit as a scholar, Professor Wasiu Adebimpe has held so many positions from various universities before occupying the post of Dean of the School of Public Health at UNIMED. According to him, the topic, Epidemiological Triad or Tetrad of Diseases, the community makes the difference, came to mind after realizing that germs has the capacity to cut short human existence if counter-offensive steps are not taken. While noting that germs are responsible for serious ailments like malaria, typhoid, measles, and diarrhea, most of the upper respiratory tract diseases are also caused by the same tiny creatures which are invisible to naked eyes. He therefore recommended practical steps that communities can take in the promotion of public health, which include health education, provision of safe drinking water, adoption sanitation ideals by individuals and families.
Germs killing man and making man sick. Is there anything that can be done? It depends on what the community can do to assist themselves locally. So we are positing that instead of a triad, there should be a tetrad, in which case all the three components of the triad will be there, but there will be a fourth component, which is the community. So whatever the community can do locally will erase whatever germs cause in the triangle. By the time it erases it and disease is no more a problem, then what we are going to have is health, which is the opposite of disease.
The Vice-Chancellor of the institution, Professor Adeshegun Fatuse, lauded the lecture, saying communities should stand up to their responsibilities for a healthy society.
What we do as community is we will eventually decide the result we get at the community level. So communities must be empowered, they must be educated, they must be supported, they must be helped to do appropriate things, to take appropriate action, and that's the mechanism by which you can prevent diseases in our environment.
Other intellectuals at the inaugural lecture were of the belief that the recommendations, if well implemented, will go a long way in stemming the spread of diseases in society.
It has been very, very educative, illuminating, and it's very stimulating too, to actually know that people are working well. They get to fight diseases, not in their own environment, but through the community-based activities to globally address how to fight and control diseases.
Incidentally, I'm also a specialist in community medicine. So all he has said are things we have been working on, not leave any of these aspects. But again, we are going to redouble our focus on that area or community as per fighting disease and infection.
This is the first in the series of inaugural lecture of University of Medical Sciences and first to be delivered from the School of Public Health in the history of the institution. Omorinola, Hungbeji, OSRC News.